Imagine yourself laying in a hospital bed. You're fever-stricken with an unbearable headache. And not only are you in constant pain, but you're in and out of consciousness, not knowing that death could only be a few short hours away. This could be a real-life scenario if you were to contract meningitis. Last week, if you guys remember, I conducted a survey just to see what you guys knew about meningitis. And I had about 5 people that knew a little bit about it, knew it was a sickness, but only 2 out of 11 people knew exactly what meningitis was. And if you compare that to a test score, it's about 18%. So we failed that one. And although meningitis is rare, it's important for us to know how severe it can be, our increased risks, and what we can do to vaccinate against it. When I was 9 years old, my cousin contracted meningitis, and she completely lost her memory. She was an interested person, involved in many activities, and she loved people, but she became uninterested in everything and now has people anxiety. Because of this, I'd like to tell you first what meningitis is and the mental and physical effects. Second, I'm going to apply it to a college setting. And third, I'm going to explain how young adults, specifically college students, can vaccinate against meningitis. I'm going to begin with an explanation of meningitis. First off, meningitis is a life-threatening disease. It can be either viral or bacterial. Obviously, bacterial meningitis is caused by bacteria, and according to the Ohio Health Department, bacterial meningitis causes inflammation in your brain and spinal cord, and then can also cause sepsis, which is an infection of your bloodstream, and it can cause a lot of brain damage. With similar symptoms as bacterial meningitis, viral meningitis is obviously caused by a virus. It's a little less lethal and comes about slower. However, there are some unique cases, and it can be a little harder to detect. As I said earlier, my cousin contracted meningitis, and she had a form of viral meningitis, which was undetected for about a week. She began the week with an upset stomach, headache, vomiting. Her mother took her to the doctor. She took her to the hospital after she started having an 105-degree fever. And then finally, after having an 105-degree fever for 3 days, she took her to Children's Mercy, where all of them released her just saying she had a viral infection. Upon arriving home from Children's Mercy, she started having a seizure and foaming from the mouth, and was taken back to the hospital and then tested for meningitis, finally, where she was hospitalized for a month. However, this didn't stop the brain damage. She had to relearn everything from her toddler age just up. She had to relearn how to walk, talk, learn, and it really affected her life. And her mom said something that I'm never going to forget, and I hope it sticks with you guys too. She said, it's something I'll never forget, something we live with every day, and something I want all parents and families to know about. This is Lacey before she contracted meningitis, and after. Obviously, she didn't have any physical changes, but that doesn't stop the mental effects on her. Now that everyone's on the same page about the severity of meningitis, I'd like to talk about meningitis in college students. College students are one of the main groups at risk for meningitis because it's spread from person to person by throat secretions or close contact. Therefore, the Ohio Health Department says college freshmen, particularly those in dorms, have a slightly increased risk of contracting meningitis. But this doesn't exclude the commuting students because they are always in close contact with students who live on campus. And between the years 2013 and 2015, according to the National Meningitis Association records, 30 cases were reported at the University of Princeton. 30 cases in one college in the matter of 2 years. And this is just a chart of how many colleges have had cases of meningitis and where they're at. So we're pretty safe here in Kansas. But if this isn't instinctive enough to get vaccinated, then I don't know what is. In case you're now thoroughly interested, my last point will show how today most college students receive vaccinations for almost all strains of meningitis. There are 5 strains of bacterial meningitis, which you can compare this kind of to like a group of humans. you would say they're all humans, right? But they're all different ethnicity, they have different hair color, different strengths and weaknesses. That's kind of how the 5 strains of meningitis are. And most students get a vaccination that protects you against 4 strains. However, there's one more that they have recently come out with. It's a Bexsero vaccine, and this is like the pamphlet for it. It came from the Ashton Hospital. The pharmacist there gave it to me, and it says, if your patients are only vaccinated against 4 of the 5 most invasive meningococcal serogroups, something may be missing. And as you can see, she's missing a finger. I personally got the Bexsero vaccine, and I'm not gonna lie to you, it wasn't that fun. It hurt a lot, but it's definitely worth it. Overall, meningitis is rare, but it's still important for college students to understand what meningitis is, how it can affect them, and what can be done to protect themselves against such a terrible disease. Meningitis is scary. However, with the information I have given you, hopefully you can address a similar situation head on.